Is a facelift required, or can this be improved with injectables? See attached pic. Hate my lower face. Looks puffy in some areas and dimply in other areas. Saggy? I don't like the area to the left and right of my chin. I also don't like the horizontal line that curves up around my chin and the outside areas of my lips to the left and right. Can fillers or dye sport be used to improve these areas, or is a facelift necessary?
Thank you for your question. You submitted a photo and you expressed several concerns about the area around the mouth, and you're asking, can fillers treat the situation or is a facelift necessary? Well, I'll certainly share with you my experience and my recommendations when patients like yourself come to my practice. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan, Long Island for over 20 years. I'm board certified by the American Board of Cosmetic Surgery, and this facial aging issue is an area that is a very important to me. It's an area of focus in my practice, and I even wrote a book a few years ago about this for consumers. So let's begin by understanding what you're dealing with. You're dealing with two issues. One is volume loss. You described dimpling and lines and sagging. Well, volume loss in the lower third of the face, especially in women, seems to be significantly more advanced when compared to the aging that happens in the upper third, the middle third of the face. Now, what that means is essentially there's bone loss along the jawline in the mandible or the jawbone, and it accentuates any jowls, as well as volume loss in the lips and in the mesolabial folds, also known as the marionette lines. Now, when patients like yourself come to our practice, I explain that part. Then I also sit with them and have them look in a mirror, and I do a vertical lift of the skin. And I ask them, do they do this at home? And they say, of course, I do this all the time. They do what's called the mirror lift. They place both their hands on their face and they push upward. So when you ask a question like this, ideally, in the perfect world, actually both procedures, both facelifting and fillers, would be optimal. Because the reality is that you can't just do one and get as close to that line of the 100% solution. You can never replace all the volume, and you can't lift someone aggressive enough to make them look 30 years younger. But you can address the elements. So with lifting, I always tell my patients that if you're able to do a facelift, then facelift is the first procedure, because that's repositioning the sagging and displaced tissue. In other words, the skin, the muscle, everything that goes downward is put back upward. However, it does leave volume loss that isn't addressed. Now, sometimes during facelifting procedures, we'll address some of that, doing something like fat grafting. However, a lot of times, and a majority of times, I tell our patients that we do the facelifting first, and then we assess what is a concern afterwards. And I show them that once I lift the face, that a certain element of the mesolabial fold will still remain, and that a certain amount of the mandibular notch, or the notch where the bone just kind of goes inward, is still going to be present. Now, there are many ways to address these issues, and of course we discuss all these things. Now, there are other patients who want to do the facelift and plan to do the facelift, but they don't have time. And for them, we offer the fillers. The fillers can be such as Radiesse, Restylane, Juvederm. And we also use something called platelet-rich plasma. It's not a filler, but it helps improve skin quality. It's derived from your own blood. But the fillers can be done very strategically in a way to help improve the mesolabial folds of the marionette lines and improve the jawline by filling in that area of the mandibular notch. There's a real art to this. And understanding how you want to strategize and what's right for you is very individual. So I recommend you meet with qualified, experienced cosmetic surgeons. I tend to always recommend surgeons because as surgeons we can do both the non-surgical and the surgical. A lot of times people who are non-surgeons, with all due respect, have a tendency to want to only offer non-surgical procedures, basically because of limitation of the scope. So essentially, the strategy that works right for you is the one that you're comfortable with. And so you have to connect and feel comfortable with the doctor who is advising you. There's a lot of ways to solve these issues, but the art is for doing it in the way that is right for you and that you're comfortable with. And of course, financial and other factors are always important, are necessarily integrated into this plan. So I hope that was helpful. I wish you the best of luck, and thank you for your question.